Hello, I'm Dr. Eric Roden, physical therapist at Neurology Solutions, and here we're going to go through a cervical exercise routine, more stretching primarily with a couple little moves at the end to kind of reintegrate proper posture. So just follow along as tolerated. Again, if you have any orthopedic problems prior, always maybe address these with your physical therapist, occupational therapist, someone that knows that musculoskeletal system well and is familiar with your conditions. Let's begin. Alright, so the first one we're going to get into is your scalene muscles, basically in the anterior cervical area. That area tends to get very tight, pulls you forward, has that forward head position, which then rounds the whole complex in the upper body. We want to get everything up, so we want to loosen that area. So the first one we're going to do, we're going to basically side tilt. We're going to rotate our head up, so pointing our nose upwards, and then bringing it back. So it's a diagonal movement backwards with a little head rotation. I like to place my hand on the collarbone. I feel a little extra stretch, and I feel that all the way up into my jaw. And we're going to do this for about 15 seconds, or give or take 5 deep breaths in and out. Good, and we're going to come back out of there. Now you want to come out nice and easy. You don't want to just fling your head out. That can cause a spasm or possibly more pain. Your body's not used to this range of motion, so ease out of it just as you ease into it. Now we're going to go to the other side. Again, tilt, nose up, head back. Get that nice stretch. Make sure we're breathing from the diaphragm. Last breath. Come out. Good. Now I always like doing both sides at least twice, if not 3 times. Your body needs time to adjust to a good stretch, so make sure you give it that chance. Don't just do one time. And it's okay to play with the angle a little bit too. If you're not feeling where you need the stretch, move it around. Alright, come back out. Let's do the other side. So maybe I'm going to go a little bit more further back. I'm going to feel that here. Versus if I tilt sideways, I'm going to feel that a little more lateral versus the front. So play with it. Find your spots that are tight. And breathe. Excellent. We're going to come out of there. So now we're going to move a little bit more lateral away from the anterior. We're going to get into your mid-scalenes and upper trap. So this one's going to be a purely sideways motion. Now you really want to use probably a mirror the first time you do this, because a lot of times we have compensations, basically compensatory movements. So you'll move your head into flexion, back, maybe you'll rotate. You want to think about a spit going right through the middle of your nose and tilting sideways. And I'm feeling a nice stretch, again, more lateral, maybe even posterior to my ear. Now I'm going to apply a little extra overpressure. You don't have to. You can just put your head there if you already feel the stretch. And I'm feeling a lot more this way. And again, because I'm talking, I'm having a hard time focusing on my breath. But again, making sure you're getting that nice belly breath. And let's come out of there. Let's switch sides again. Nice tilt going through that spit. Add a little extra overpressure if you need it. You may not. You may already feel a really good stretch. And again, you want to feel a stretch, not pain. Discomfort of a stretch is very different than an actual pain of, ow, that actually hurts my neck, might be my joint, versus, whoa, that's a really big stretch. All right, let's move back to the other side again. Here we go. Feel that nice stretch, and make sure that arm stays relaxed. A lot of people start bringing up that elbow or that shoulder. Keep everything elongated. Neck nice and tall, posture nice and tall. And let's switch one more time. Here we go. You guys are doing great. You're probably already feeling a little looser. I know I am, especially first thing in the morning. You tend to be a little tight. Or after a long day at the office, if you're working on a computer, definitely important to be able to take breaks and do this. All right. So, next time, here we go. We're going to go a little bit more posterior now. So into your levator scap, even posterior scalene, even a little bit of upper trap still. So I call this a sniff your armpit stretch. It'll make sense once you actually do it. So we're going to take our nose, just like our first one, we're going to side tilt. But instead of going up, we're going down this time and bringing our head forward. And I'm feeling that definitely posterior, even into my shoulder blade. Now the sniff your armpit was when you apply the overpressure. I'm going to grab on that posterior area, more on the right side, and I'm going to pull towards my armpit. And I'm feeling a lot more intense of a stretch. And we're breathing. Good, let's come back out, nice and easy. We're going to come to the other side, tilt, head down, head forward, and sniff the armpit. Nice and easy. Let's go one more each side. Tilt, nose down, head forward. Again, play with it. Maybe you rotate a little bit more, maybe you don't. Find that position where you feel the good stretch. Be always trying to find those tight spots. The muscles have a mind of their own, and they always want to try to go in the path of least resistance. And you want to actually find that resistance and see if you can release the tension. Excellent. Let's come out of there. Last one. Last breath. Excellent. So now that we're loosened up a little bit, we want to just do some active range, engage all the muscles of the cervical spine. So we're going to just do some simple head circles. If you have any dizziness, just be a little bit more cautious, maybe reduce your range. Or if you have pain with end range motion, keep it limited in that pain-free range of motion there. So let's go down. And we're going to rotate around. Again, I'm trying to get as much range as possible through the movement. I'm trying not to move my shoulders too much, just isolating it to the head. I'm trying to keep my good posture still. Nice and easy. Maybe find a spot and you work that area just for a second. I feel a little tightness there compared to anywhere else. And let's keep moving. Last one. Okay, let's go the other way. Our bodies go both directions. Excellent. I'm feeling some snap, crackle, pops. Not uncommon. Alright, now we're back middle. Okay, my head already feels a little wobbly, kind of feels like a bobblehead. Pretty normal, you've just released a lot of tension there. Now what I like to do is now reintegrate into a couple postural exercises. Very simple, but still very effective. First one is just a simple shoulder blade squeeze. So your shoulder blades on either side, we want to pinch them back and down together. We don't want to be raising the shoulders. That's not going to do anything for us. So everything's going to pinch back and down, like you're trying to pinch a pencil between those shoulder blades. 1, 2, 3. Release. Good. And again. 1, 2, 3. Release. We're only doing 5 of these. Again. 1, 2, 3. Release. 1, 2, 3. That's 4. Last one. 1, 2, 3. Good. Now, these are not necessarily a true strengthening routine. This is just to reintegrate that posture. We'll have a separate video for actual postural strengthening, so stay tuned for those. Now, the next one's going to be a chin tuck. Now, you got to be careful with this. If you go overboard and too extreme, you can actually induce a headache. So be very gentle with this movement. So I'm going to do a forward view, and then I'm going to turn sideways. So it's a chin tuck. I'm sitting nice and tall, and I'm slowly pulling my head back and releasing. It's a very subtle movement. 2, 3 for a side profile. Let me bring my body this way. And again, here's my finger, and I'm coming back. You can see me translating back. I'm not tilting down. my whole head shifts. And I'm feeling some pressure in the back here, as well as some tension in the front of my neck. That's where you should be feeling it. The headache that can occur comes from those suboccipital muscles in the back. If you overstretch them too aggressive, they can, boom, induce a headache. All right, that's our cervical spine routine. Stay tuned for more videos from Neurology Solutions. Again, this is Dr. Eric Roden. Thanks for joining us.